Welcome all to this module on climate change and cardiopulmonary diseases. I am Dr. Harshal Ramesh Salve, presenting on behalf of Center of Excellence on Climate Change and Cardiopulmonary Disorder under National Program of Climate Change and Human Health, All India Institute of Medical Sciences, New Delhi. These are the members of Center of Excellence at AIMS, New Delhi. Under this module, we are going to understand what is climate change, what are cardiopulmonary disorders in the context of climate change, and how climate change and cardiopulmonary disorders are connected, and what are the actions you can take at state level and the district level to mitigate the impact of climate change on cardiopulmonary disorders. Now, what is climate change? Till now, you are aware about the definition of the climate change. Climate change is a long term change in the Earth's cities or any local climate. This includes warming and the cooling. So, one thing we need to understand, this is a long term process. The causes of climate change majorly are the use of fossil fuels and deforestation. So, basically, majority of the climate change is happening due to the human behavior. We call it as anthropogenic causes of the climate change. Greenhouse effect. The sun rays, which also brings heat to the earth, get trapped due to these greenhouses, which also includes carbon dioxide, and that increases the earth's surface temperature over a long period of time. And these greenhouses also blocks the cooling effect and the evaporation of that which is natural of this heat outside earth in the space, that again adds to the increase in the surface temperature of the earth. And this phenomenon we call it as a greenhouse effect, and this ultimately leads to the climate change by increasing the earth's temperature. Indicators of climate change are increase in the temperature, humidity, sea level, ocean heat content, extreme weather events, species migrating upwards and towards the pole, and increase in the sea surface temperature. Decrease in glaciers, sea ice, and snow cover are also important indicators of the climate change. This epidemiological triad explains the occurrence of any disease. This epidemiological triad includes agent, host, and environment. When these three factors interacts, then the disease occurs. And climate change affect each of these factors. Hence, it affects the human health. Let's understand this. With respect to the agent, the climate change impacts various pathogens which causes disease by impacting its generation, by impacting its multiplication. For example, vector. The mosquito replication, its duplication, and its breeding places get impacted heavily by the climate change. And that's why that leads to the changing in the malaria and the dengue pattern across the country. Climate change also impacts the environmental factors of the occurrence of the disease. For example, increased temperature that leads to the heat stroke, extreme heat and heat waves, erratic rainfall that leads to the more vector-borne diseases occurrence, contamination of the drinking water due to the extreme weather events that leads to the post disaster outbreaks of the diarrheal diseases. Climate change also impact the host factors, for example, crowd displacement, migration. It also impacts the host immunity by impacting the nutrition. As due to the climate change, the agriculture products diversity decreases, agriculture production decreases, hence the availability of the nutritious food decreases, the nutrition diversity in your day-to-day life decreases, and more vulnerable population get affected, and they get receptive to the various infective agents as well as the non-communicable diseases, and this leads to the diseases. So with this we can understand that climate change impacts all the three factors of the epidemiological triad, so that it affects the human health. Which lead to the variety of the diseases from the communicable diseases, for example, malaria, dengue, encephalitis, hantavirus, and other mosquito driven diseases to the non communicable diseases, for example, cardiovascular diseases, COPD, heat related diseases, malnutrition. So, variety of the diseases are linked to the climate change. Hence, the climate change has to be given the priority if we really need to address these diseases at the population level. If you see the mortality, amongst the mortality due to the environmental factors, non-communicable diseases constitutes the majority of the mortality. Hence, this module is very important in the form of cardiopulmonary diseases, which constitutes majority of the mortality in the population level. Now, let's understand what are the cardiopulmonary diseases in the context of climate change. Cardiopulmonary diseases are considered as one of the important climate sensitive health issues under the National Program on Climate Change and Human Health. Cardiopulmonary disease also contributes majority of the burden of the disease in country. Hence, it is very pertinent to understand the impact of the climate change on cardiopulmonary diseases. Common cardiopulmonary diseases are ischemic heart disease, valvular heart disease, pericardial disease, hypertensive heart disease, rheumatic heart disease, circulatory diseases. So majority of the diseases which affect hearts and the circulatory diseases that constitute the cardiac diseases. Pulmonary diseases includes chronic obstructive pulmonary diseases, asthma, acute asthmatic attacks, allergy exacerbation, interstitial lung disease, and lung cancer. There is a lot of evidence available in the public domain which linked climate change with all these cardiopulmonary diseases. So it is proven beyond doubt that cardiopulmonary diseases are linked to the climate change. Burden of the cardiopulmonary disease is ever increasing in the current century. It almost constitutes more than 30% of the mortality and morbidity in the population level in India. If we see the transition from the last decade, the clear cut trend of decreasing the communicable diseases and increasing the non communicable diseases is seen. So, ischemic heart disease and COPD now constitutes the majority of burden of the diseases. The daily mention here is disability adjusted life years. This gives us the burden of the diseases at the population level. Now we need to understand the risk factors of the cardiopulmonary diseases. As seen in this pyramid, the base is made by the more generic factors and tip is constituted by the diseases. So like the iceberg, what we see in the iceberg is very small part. The larger part lies beneath the water level. So we need to address this risk factors which are larger in proportion, which are larger in quantity. Majority of the population gets affected due to it in order to address this small proportion at the tip of the cardiopulmonary diseases. So what are these larger factors? These larger factors can be classified into three levels: the underlying drivers, behavioral risk factors, and metabolic and psychological, physiological risk factors. The underlying drivers of the cardiopulmonary diseases are social determinants of health, globalization, urbanization, population aging. Due to the urbanization, the population movement from rural to urban side happens. That leads to the change in lifestyle, that leads to the mental stress, that leads to the uh, increase in the slum population, decrease in the health access in this such population. The vulnerability of the population increases for various diseases. Environmental factors, for example, air pollution, increase in the temperature, and other environmental risk factors in the form of allergens, pollens in this environment, other pesticides in the environment that leads to this cardiopulmonary diseases. Air pollution is an important contributor of the cardiopulmonary diseases that includes both household air pollution and ambient air pollution due to the which is linked to the vehicular traffic. Now, coming to the behavioral risk factors. These are the risk factors which are linked to the individual behavior that includes tobacco use, alcohol use, unhealthy diet in the form of excessive consumption of sugar, salt, fatty items, and physical inactivity. Metabolic and physiological factor includes overweight, obesity, raised blood pressure, raised glycemic level, raised lipid level. And all these factors leads to the cardiopulmonary diseases. Why it is important to understand this factor? Because the intervention which you will do at the state level and the district level or at the city level, these are driven by all these factors. So intervention for the social determinants and the underlying drivers are more at the policy level. The interventions for behavior risk factors are more at the population level, community level, individual level, behavior change communication. The interventions for physiological risk factors are more at the surveillance level, epidemiological level, more sort of programmatic level in terms of treatment, screening of these disorders. So that's why it is important to understand all these risk factors. The recently concluded national level survey also gave important information related to the increase in these risk factors at the population level in India. You can see here, even the rural area is severely impacted by these risk factors of cardiopulmonary diseases. These are more common in the urban area. And this is more important to understand that though the risk factors are common, our health system in urban area is not organized as we have in the rural area in the form of primary, secondary, tertiary level. So challenge is more in the urban area to address this problem. Air pollution complicates the entire scenario of the cardiopulmonary diseases and the climate change. More than 7 million excess deaths are reported due to the air pollution. 4.2 million due to the ambient air pollution and almost 3.5 to 4 million due to the household air pollution. And majority of these deaths are due to the cardiopulmonary diseases and the and due to infectious diseases of lower respiratory tract infections. Vulnerable population, elderly, pregnant women, and children are affected due to air pollution. So, air pollution actually complicates the scenario of the climate change and the cardiopulmonary diseases. Our actions should be more comprehensive if we really want to address this problem in the community level. If we see the annual population weighted mean in India, it is more than 8 times of what is recommended by the WHO. So there are other drivers and the other factors which we need to understand when we see the linking pathway of the climate change and cardiopulmonary diseases. The environmental and institutional context, the land use change, the ecosystem change, infrastructure condition, urban planning and design also plays an important part in augmenting the cardiopulmonary diseases. Hence, whenever we have a scope of intervention at the policy level of all these factors, that has to be leveraged for our actions. There are other social behavioral contexts, the vulnerable population in the form of age, gender, poverty, housing infrastructure, education, other behavioral risk factors, and pre-existing comorbidities. These are also the drivers of the cardiopulmonary diseases which are linked to the climate change. Extreme weather events that again leads to the population displacement, change in the routine lifestyle, post-traumatic mental stress, which again leads to the impaired access to healthcare and impaired personal care. Then again that leads to the this behavior related to the substance abuse. So all these factors again contributes to the cardiopulmonary diseases. For example, extreme heat that leads to the failure of the hemostasis in the body and that exacerbates the cardiovascular diseases and the chronic respiratory diseases, particularly among elderly population. The increased ozone and the pollen and aeroallergens leads to the exacerbation of asthma. Both these factors can contribute to the deaths. So, as I said before, there is ample evidence available which links the air pollution, climate change, and the cardiopulmonary diseases. And this table again gives the individual level factors that leads to the individual diseases. So you can see here most of the cardiopulmonary diseases are linked to the environmental exposure that is associated with the climate change. It is important to understand the vulnerable groups which has a maximum impact of climate change with respect to cardiopulmonary diseases that constitutes the elderly, the population with pre-existing heart disease or pre-existing comorbidities, the patient on diuretics, the workers who are working in the heavy physical work in the open environment, and the people who are other way they are vulnerable in the form of low socioeconomic status, people living in a difficult area with low access to healthcare. So all these contributes to the vulnerable groups, and that needs a special attention. So whenever you plan any intervention or any action at the state or district level, you should prioritize these groups with respect to the cardiopulmonary diseases. Coming to the actions to mitigate impact of climate change on cardiopulmonary health. So major domains of actions are five: advocacy and communication, capacity building and system strengthening, situation analysis, monitoring, surveillance and research, and integration of the cardiopulmonary disease management during natural calamities or extreme health, extreme emergency events or extreme weather events. This is also included in your state action plan of climate change and cardiopulmonary diseases. Now, coming to the first domain, advocacy and communication. The communication with a specific message to the right person, multi-stakeholder engagement, and community participation. These are the guiding principles of advocacy and communication that needs to be taken into account whenever you plan any actions with respect to the climate change and cardiopulmonary diseases. And we need to engage all important stakeholders from political leadership, Department of Health, Women and Child Development, Panchayat Raj Institution, water and sanitation, disaster management authorities, IMD, right? Weather department. So all needs to be engaged in to form a specific actions which are listed in this table. And we also need to assess our methods by putting this into our yearly assessment plan. But number of yearly meeting held with all stakeholders, IEC campaign carried out, engagement meeting occurred, the multi collaborative efforts which has been taken on annual basis. So all this activity has to be monitored also. Situation assessment. The guiding principles of situation assessment are epidemiological principles, coordination with health department, and involvement of the medical colleges. So medical colleges involvement is very critical because they provide you the technical support for carrying out the surveys, carrying out the surveillance activities at the state level or at the district level. So that helps in mapping the human resources, material, financial resources, assessment of the various burden of the cardiopulmonary diseases in the health system, assessment of the risk factors, vulnerability assessment. So this activity will help you to assess the baseline information, so that that will help you to prioritize your action, and that will also help you to take a stock of the situation after your intervention. So important stakeholders for these actions are State Program Office of NPCDCS. There is a national program for control of non-communicable diseases. You need to liaise closely with them in order to get the information of the cardiopulmonary diseases. Medical colleges, weather department, and pollution control boards also constitutes the important stakeholders. And there is a need to carry out annual surveys. There are existing surveys which also happens, but if you require, some surveys can be carried out. The national NCD risk factor survey can be carried out, and that will help you to assess the situation on various bases. There are larger surveys in the form of national family health surveys, which is available, that helps you to get the information at the state level. Next domain is capacity building and system strengthening. Trained manpower is a key for climate actions, and developing climate resilient health system is also important pillar of your actions. So that's help you to strengthen your response as far as the mitigation of cardiopulmonary disease are concerned. So we need to develop the availability of the manpower, and the quality manpower is very crucial. So, and it also require engagement with other stakeholders like NHM, medical colleges, district program managers, state program officers of NPCDCs. So whatever level the manpower is available, appropriate job sharing and appropriate leveraging of the existing staff and the facility has to be done. And time to time capacity building activity has to be held for cardiopulmonary diseases and the climate change. And coordination with the NPCDCS will be important with respect to this domain. Next domain of action is monitoring, surveillance, and research. So monitoring is an essential component of any program. So as for this climate change, under this climate change program, in having a structured monitoring framework for implementation and the prevention, the curative actions is very critical. Collaboration with the IMD to get exposure information, for example, air pollution related information, weather related information is critical. Have a linkages with the medical colleges, have linkages with the state program officers of NPCDCS, NHM officers to get information with respect to outcome, that is cardiopulmonary diseases, and monitor on to quarterly basis and annual basis. This will help you to refine your actions on climate change and cardiopulmonary diseases. Integration of the cardiopulmonary disease management during natural calamity. Again, at the time of natural calamity or at the time of extreme weather events, the preparation and the community participation is the key. And specific action in the form of developing SOPs for management of CPD is very crucial. It is being provided in your state action plan. Creation of the emergency response team and developing post-emergency plan is also critical. Important stakeholders at the state level, health program officers, National Disaster Management Authority. And we have various documents available from WHO, from Government of India that will help you to develop this emergency framework. Briefly, there are some medicines which are and the technologies which are essential for management of cardiopulmonary diseases, which are available at the primary care facilities. You have to ensure as a part of your health system preparedness that this list should be available. At least these are the bare minimum technologies and the medicines which should be available at the primary care level. Coming to the SOPs for integration of the CPD management in the emergency response. This can be categorized into three phases: preparation phase, emergency phase, and post-emergency phase. Coming to the preparation phase, the identification of the priority conditions for inclusion of the emergency response. As far as the cardiopulmonary diseases are concerned, we already discussed the asthma, COPD, the hypertension, diabetes management, the heart disease management. That has to be a priority conditions. And also depending on the condition in your state, using the surveillance data, the program data, you can prioritize the condition which can be included in the emergency response. Preparation on the pre-emergency profile of the cardiopulmonary diseases. What is the burden? What are the age group which is affected more? What is the health seeking behavior of the population? That information should be readily available to you. Assessment of the health facility preparedness in the form of availability of the manpower, availability of the machineries, equipment, medicine, availability of the emergency response plan needs to be ensured. Coordination between the various health agencies and the community and other non-health agencies is very crucial, and you should be ready with the contingency plan before the emergency and types of emergency whatever which is common in your state or in the district you are working. That has to be mapped out. Availability of the essential medicines and technology, as I said before, it should be available, it should be made sure. And individualized emergency plan should be made. Second phase is emergency response phase, where integrating the CPD in the initial rapid assessment. In the emergency, cardiopulmonary diseases should be given a priority in the plan management. CPD service provision. Whenever there is an emergency map, how the services can be provided to the population with the cardiopulmonary diseases. These are the chronic conditions and that requires a long-term treatment. So compliance to the treatment, adherence to the treatment, availability of the medicine at the doorstep, using the IT technology for consultation, using more sort of laboratory technology, mobile medical units can be leveraged in the emergency situation to provide a care for these cardiopulmonary diseases at their doorstep. CPD services delivery mechanisms. in the form of mobile medical units, the doorstep using food soldiers in the form of ashas, ANM, the health workers, using more sort of local systems, the form of sub centers, primary health centers, to deliver a cardio management, treatment, counseling, screening, and management of cardiopulmonary disease related services. Third is the post-emergency phase in slow onset emergencies, or where the onset is not slow. Debrief lessons learned during the emergency has to be mapped out, that should be listed, and that should be continued to the and that should be included in the capacity building training. Strengthening health system response, the gap should be identified, challenges for the emergency response should be identified, and that needs to be addressed in the subsequent response. Public health response in the form of behavior change communication, availability of the services needs to be strengthened, and of course monitoring and evaluation of the emergency response, that will help you to identify the gaps, challenges in the emergency response, and same can be rectified for the future use. Vulnerability mapping, again an important exercise. The states and the district under you can be mapped as a high, moderate, and low for using these five parameters: geographical location, tobacco use, health system status, obesity prevalence, and air pollution zone, using air pollution data using suffer into high, moderate, and low. And you need to prioritize the districts which are categorized as the more vulnerable, the high vulnerable, as far as the emergency response is concerned, and also in the routine actions all in whenever you make your plans and the district level PIPs. So these the districts which are in the high priority in the vulnerability mapping needs to be prioritized for the actions. Now, coming to the IEC, the messages in the community has to be more specific, has to be more contextualized, local, and that includes the more uh, sort of reduction in the use of fossil fuel, resulting in the deforestation activities. Uh, that needs to be focus of your behavior change communication when you prepare various tools for or the material for the behavior change communication. This can be utilized. So these are messages should be focused on preventing deforestation, reducing the energy consumption use, promoting more solar or the natural use of energy. With respect to the cardiopulmonary diseases, promotion of the physical activity in day-to-day life, balanced nutrition in the day-to-day life, that includes reduction in the salt, sugar, and fatty substance into day-to-day life. That all this behavior change communication will lead to the decrease in the burden of the cardiopulmonary diseases. Substance use, stopping tobacco and alcohol use, regular monitoring the BP and the blood sugar. So all these should feature in the behavior change communication related material, whichever you make at the state level or the district level. And these messages should be contextualized, should be localized with, and it should be prepared with the more community engagement. And the channels, for example, local community channels, the school children's, the more food soldiers with respect to the Panchayat Raj institution, the village healths, the RWAs should be engaged for promoting this healthy behaviors for prevention of the cardiopulmonary diseases. This will lead to the positive deviance, what we call at the population level, and that ultimately leads to the decrease in the burden of the cardiopulmonary diseases. So, what are take-home messages? Cardiopulmonary diseases are the important climate-sensitive health issues under the National Program of Climate Change and Human Health, and mitigation of impact is possible with the prevention and the control of the risk factors of cardiopulmonary diseases. Under this program, AIMS New Delhi has been identified as a center of excellence of the cardiopulmonary diseases. And as I mentioned before, the state action plan has a specific chapter on the cardiopulmonary diseases, and same should be implemented. And same actions can be modified depending on the local needs, depending on the context where in your state and the districts. And so the feedback from you for modifying this state action plan are welcome and same should be sent to the program. The coordination of the National Program of Climate Change and Human Health Division of NCDC and the state program officers are very critical in taking this program forward, as well as this is in the benefit of the community at large, so that the impact of the climate change on the cardiopulmonary diseases can be mitigated and the population health can be improved by our coordinated effort. Thank you. If you have any questions, I'm happy to answer.